Imagine you're driving on the interstate, going on a day trip with your family, and you come across a car accident, or maybe you're involved in a car accident, or say you're at the mall shopping with friends, and all of a sudden you hear active gunfire, people are running around screaming, and all of a sudden there's chaos everywhere. These two situations have one thing in common. They can have major bleeding. My name is Jacob Green, and in this speech I'm going to show you how to control major bleeding with using a tourniquet. Now this is a situation I hope that you're never in or need to have to use this skill, but I hope that within this speech it motivates you to want to learn a little bit more about it and maybe learn a couple other things along the way. Now I can show you the skill because I'm a nationally accredited EMT who has proven myself through testing, skills testing, and experience to be able to show you how to use a tourniquet. In this speech, I'm going to give you a brief history of the tourniquet, how to use a tourniquet, and when to use a tourniquet. First, let's give you a little bit of history about the tourniquet. According to tourniquets.org, they've been around since the Greek and Roman times. And in those times, they used them mostly in surgeries during amputations. When there was bleeding on the battlefield, they would tie cloth around as tightly as they could to stop bleeding. Those are initial rudimentary tourniquets. They weren't really called tourniquets back then. They didn't really have a name for them. And it wasn't until around the 1700s when French surgeon Jean-Luc Petit invented an invention that he called a tourniquet, which comes from the root French verb tourner, which means to turn. Now these were mostly used in wartime to stop bleeding when it comes down to bullet holes or cuts on extremities, legs and arms. You can't really use them anywhere on the torso. You can't really stop bleeding that way in those areas. A surgeon used them in early times to stop bleeding on a limb that they had to amputate through having a bad break or an infection. And at those times, they didn't have the necessary equipment or health standards we do now. So a lot of times they just resulted in amputating the leg. And to do that, they used tourniquets to stop the bleeding so they could successfully amputate the limb. Now that I've given you a little bit of history about the tourniquet, I'm going to show you when it's important to recognize to use a tourniquet. Now I'm going to use my assistant here. And for speed's sake, we're just going to say that she was in a car accident. I've noticed that she has a large laceration on her right forearm, and it's showing arterial blood. Now, the first step I'm going to take when figuring out when to use a tourniquet is I'm going to apply direct pressure to the wound. Now, when I apply direct pressure to this wound, I'm going to be doing it very, very tightly. Now, according to pre-hospital emergency care, it takes up to a few seconds to really kind of see if bleeding is going to stop via pressure. If you do get it to stop, then you pack the wound, gauze it very tightly again to kind of help stop the bleeding, and you move on to any other injuries, or if there's other victims, move on to the next one. Now, I recognize that I can't stop this bleeding. So next step, I'm going to have to use a tourniquet. According to Prep Medic on YouTube, he says that you need to locate a spot about 2 inches above the wound, and especially make sure that you do not place a tourniquet within a joint. So this here is your standard tourniquet that most medics and EMTs in the field are going to be using. These come in a pretty much one size fits all, so they can go around your thigh if need be, upper bicep, closer to the shoulder. You know, some men or women are larger than others, so they can get very large in size to make sure that you can control and stop the bleeding. Since this is forearm wound, there's going to be a lot of extra slack, and that you just kind of push out of the way. So when you're putting on the tourniquet, you want about 2 inches above the initial wound. So I have the laceration here. Again, either if I didn't have a partner, I'd ask her if she's conscious to hold the wound. Otherwise, I'm going to work as quickly as possible to stave off as much blood loss as I can. So I'm going to tighten the tourniquet as tight as I can before using the metal rod to control the bleeding. So the tourniquet's tight. I'm going to then turn, again, this metal rod until bleeding is stopped. I'm going to lock it in here and write the time that I applied this tourniquet on here. You don't want to have a tourniquet on for more. Blood will actually start to die within this wound and cause the infection to get worse, and that may actually cause loss of limb. Again, that's 4 hours is quite a bit of time. Today's standard, usually you're pretty close to a hospital, and if it's a severe enough accident, they can fly you there in a very short amount of time. So again, this would have stopped the bleeding. You would want to see no blood coming from the wound anymore, and you would not feel a pulse below the tourniquet. Now you're going to want to check for pulse up here. You will feel it, but you should not feel it down here, and you should not see any blood loss anymore. And then this will give you time to now wrap this wound. Again, assess any other life that she has. If there's any other patients, move on to the next one. Now I'm going to remove this so it's a little more comfortable for her. So, at the end of the day, this is a skill I hope that you never have to use, but it's a very important one to know in the case of an emergency. With this speech, I hope it motivates you to go online and maybe learn a couple other skills. How to position someone in the case of a head injury, how to maybe assess a situation for shock and assist somebody when they're coming out of a car. A good website to use is YouTube again. You go to EMT Prep. It's a nationally accredited source on YouTube that a lot of EMTs actually use for their skills testing. It's actually a very up-to-date resource and how to learn a lot of good life-saving techniques. Again, thank you for your time and stay safe.